bet. Dr. Gordon, also, when you get patients coming in, how do you know when to say under the muscle you want to put the implant or over the muscle?
That's a good question. Okay, if the patient is a first timer, if this is their first breast augmentation, then I generally like to use a textured silicone implant under the muscle. Now, texturing simply means that it does not have a smooth outer shell, but rather a shell that is textured like the fabric of a chair, of a comfortable chair, fabric chair. And when this implant is placed between or under the pectoralis major muscle and on top of the minor, so it's between the pectoralis major and minor muscles, then these muscles, whether it's philosophical or in fact the case, these muscles are able to grip that implant and hold it in position. Whereas a smooth implant is going to tend to slip around a little bit more, it's going to tend to be susceptible to the effects of gravity, and it's going to tend to have a greater opportunity to drift lower on the chest wall and lower in the breast and create, a bottom-heavy, bottoming out sort of an appearance, which is not desirable. We use the textured implant initially, and then if a patient comes back, some years later and wants to change the implant for some reason, then I think a smooth implant is a good choice, and I usually put it in the same pocket. Now, as far as on top of the muscle versus under the muscle, an implant placed on top of the muscle, meaning right under the breast gland, theoretically should look better, because when you're augmenting the breast, you're not augmenting the chest. We're not trying to augment the muscle and the breast necessarily, but the reality is that implants placed under the gland alone tend to be more visible. And if it's a saline implant, it can ripple, and even if it's a silicone gel implant, it can have an unnatural round arc sort of an appearance to the upper part of the breast that sticks up out of the top of the dress or bra. So by putting an implant under the muscle, you tend to get a more gradual transition from the collarbone to the nipple, and you don't get this bump, this mountain or this hill. So I think it's a little bit better.